Hey, Dr. Mary here. I wanted to come on real quick and talk to you about fatty liver, high blood pressure, blood sugar imbalances. What else am I seeing? Weight gain that's just not coming off, joint stiffness, waking up with headaches every day, or struggling with migraines. I want to address this because so many times people feel, okay, well, that is a pill problem, meaning I have high blood pressure, I need to go take a pill. I've got, blood sugar issues, I need to take a pill. I've got pain and stiffness or headache, I need to take a pill. And a lot of times it's not a pill problem. The problem actually is inflammation. Have you heard of it? Do you know of it? Maybe you know. Inflammation is literally our body fighting off like all of these free radicals that are happening. So let's take fatty liver, right? It's a common thing, very common in menopause, perimenopause, women, men. A fatty liver happens a lot of times when we get out of balance in our diet. Okay, so it can happen with too much fats, but it also can happen with just eating too many carbs. So I see it even actually in the Asian population and clients that I've had, is that because their diet maybe is more rice-filled, Filipinos as well, is that extra carbs that they're having in their diet that once their body could handle, no longer can handle. So it leads to fatty liver, you're feeling sluggish and, it's all down. But it's actually the inflammation that those carbs create, okay? So high blood pressure, the same thing. It's a lot of times an inflammatory problem. And I'll give you a quick tip on that. Increase your water. Increase your water, decrease the other caffeinated drinks, inflammatory drinks, all of that. And you can usually see anywhere from 10, 30. I've seen people 100% correct their high blood pressure with just water alone. But if you can stop the inflammation and lose some weight, a lot of times the blood pressure issue will be corrected or improved, okay? So inflammation. You're waking up with a headache every morning. I'll give you a tip on that too. It is an inflammatory condition, but it has a lot to do with probably your mouth breather. And breathing through the mouth is going to cause more inflammation. It's going to cause a decrease in oxygen. We need to breathe through our nose. All of these simple things. But the reason I came and wanted to bring this to your attention and why these things are an inflammatory condition, hormone imbalance, insulin levels all over the place. The reason that we're having is it's an inflammatory problem. And one of the solutions that I have been helping women for decades get the inflammation out of their life. But now we've really honed in. We have a program that not only helps people decrease the inflammation, but it helps them lose the weight too, because extra weight is going to be inflammatory. You have more than, I'm not just talking 10 pounds, but 20, 30, 40, 50 extra pounds on your body. Your body's constantly going to be in an inflammatory cycle. And so when we can lose that inflammation, which usually in the first 10 days of our Rev Up program, most people can lose anywhere from 5, 10, sometimes more in just inflammation. It's gone. They're sleeping better. They don't have the headaches anymore. They don't have the pain and stiffness. They can get off the couch without feeling like an old lady, okay? You can do this. Our Rev Up weight loss program, our wellness program, 10 days is coming up on January 8th. If you know someone who's struggling with those things, I encourage you to get them to join us. It's not a pill. It is some supplementation. It's some eating right. It's drinking your water. It's moving your body. Yes, it is work, right? It is work, and it's not free. It's not free. It's going to take work to get your body back. It's going to teach you the first steps to better health. It's going to teach you the first steps to living a more healthy life, a longer life. Inflammation is the root of almost all conditions, including cancer, okay? So I'm on a soapbox right now. Who do you know who needs to be tagged in this video and woken up to what's going on with them? Is not a pill problem. It's not a pill problem. It's an inflammation problem. And we have a solution in the Rev Up Weight Loss 10-Day Challenge, where we give you the first steps to flushing the inflammation out of your body, feeling better, and helping you get on the road to health. I hope you'll join us, all right? I'll put a link below, and if any of you have been in the Rev Up, make sure you tell people what it's done for you. Bye.